Okay, we're going to be doing med administration this morning, and so I'm going to be this is going to be the first part of preparing, getting our meds, getting ready to start giving meds. So the first thing I'm going to do is I'm going to go to the, I'm in my nurse's station, and at the beginning of my shift, so I'm going to be comparing and making sure that I'm verifying that my MAR is going to match my doctor's order. So I've got Smith Brad, date of birth 4/24/1957, allergies to codeine, and our admission diagnosis, uncontrolled diabetes, right otitis media, conjunctivitis, infection from diabetic ulcer, pain, congestive heart failure, asthma, and nasal congestion. And my patient's 6 foot, 256 pounds, medical record 54321. So I want to go over to my medication administration record, and I've got Smith Brad, date of birth 4/24/1957, allergies to codeine, uncontrolled diabetes 2, right otitis media, conjunctivitis, infection from diabetes ulcer, pain, congestive heart failure, asthma, and nasal congestion, 6 foot, 256 pounds, and medical record is 54321. So that matches between my doctor's orders and my MAR. So I'm going to go back to my doctor's orders, and I'm going to start verifying one med at a time between the MAR and the doctor's orders. I read the admission diagnosis, so as I'm reading my medications, I can verify that the reason the patient's getting it, is there admission or is there a diagnosis that fits why they are getting that. So we're going to start with the first one. So I have Smith Brad, 4/24/1957, date of birth, and I have MPH insulin 5 units subcutaneous AC. So I'm going to go over to my medication administration, and I have Smith Brad, date of birth 4/24/1957. I have MPH insulin 5 units subcutaneous AC. AC means before meals, so I should have 3 times. I have a 9 o'clock, a 12 o'clock, and an 1800. So the times match the times on this, and this matches my doctor's order. So I verified that one. Go back, and I have Smith Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. And go to my MAR. I have Smith Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60 beats. It's daily 1 time, and it's scheduled at 9 o'clock. So that is correct. The time matches this, and this matches my doctor's orders. Go back. Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstitute with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per mil. Give 350 milligrams of final solution IM BID. Okay, I'm going to go to my medication administration record. I have Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstituted with 2.1 mil 1% lidocaine for a final solution of 350 milligrams per mil. Give 350 milligrams of final solution IM BID. BID's twice, so I have a 9 o'clock and an 1800. My times match the order here, and then this matches the physician's orders. It's verified there. Smith Brad, I'm back at my physician's orders. Smith Brad, date of birth 4/24/1957. I have tobramycin eye drops, 1 drop in left eye daily. Go to my medication administration record. I have Brad Smith, date of birth 4/24/1957. And I have tobramycin eye drops, 1 drop in left eye daily, so just 1 time, and I have a 9 o'clock, so my time matches that it's daily, and that matches my doctor's orders. Go back to my physician's orders, and it looks like that was all of my medications. So I'm going to go back to my MAR, And up here where it says verified, I am going to put my name and initials and my credentials, or my name and my credentials, so they know that we know that this MAR has been verified and it is correct with the doctor's orders. So I have J. Buckskipper, MSN, RN. You would put your first initial, your last name, and then your credentials according to which school, nursing school that you're in, okay? So once I have done that, this is the first part of getting ready to do our administration. So now I'm gonna go ahead and close out my computer, okay, at the nurse's station, and I'm going to get ready to go to the medication room. Okay, so I have already verified my MAR, made sure that my doctor's orders, the MAR matched my doctor's orders. So the second part of our med administration is I'm going to the medication room. And in the med room, I'm going to go ahead and do a medical hand wash. And I'm going to pull up my computer. And at this point, I'm just going to be working off of my MAR because I know that I've checked it and it's correct. And so, make sure I've got everything that I need here. All right, we're going to start with the first medication. Just get everything that I'm going to need out here just real quickly. Okay, this is going to be the first check. Again, we're in the medication room. We did our medical hand wash when we came in. And so I'm going to, in the medication room, we're going to do 2 med checks before we go to the patient's room. So I have Smith Brad, date of birth 4/24/1957, NPH insulin 5 units, subcutaneous AC, and I'm going to be giving the 9 o'clock dose. So in my hand, I have Practi NPH insulin, okay? It's U100. And the expiration date is 5/2026, so it is intact, okay? And if this was brand new, I'd pop the top. If it was used, I would be looking to make sure the date, time, and initials, that it's within the 24 hours. Even though it has a expiration date, once this is opened, it's only good for 30 days. So then I also have my insulin syringe. It is a U100, which matches my U100. I'm making sure that the package is intact, and there's an expiration date down here on the end, which is 2/2026, okay? So once that I've made sure, and my NPH insulin is my NPH insulin, it matches my medication there, and I'm going to be pulling up 5 units. So before I do that, I'm going to go ahead and get my label ready. So I have NPH insulin. We're going to be doing 5 units. And it is sub-Q. And I'm giving the 9 o'clock dose. And then I'm going to initial there. Okay, so I've got that ready. I'm also going to be, before I finish, I'm going to be date, time, and initial because this is a brand new one. So I've got my date, time, and initials so that whoever uses this knows when that 30 days is up, okay? All right, so I'm going to go ahead, and NPH is an intermediate. It is cloudy, and so the precipitate usually is at the bottom, and we've got to roll to make sure that the precipitate is in the solute, which is a solution. Okay, once I've done that, then I'm going to go ahead and get my alcohol swab. I'm going to clean the top of that really good. I'm going to go ahead and get my syringe out. We've already checked to make sure it was the correct syringe. I'm gonna get my trash over here so I can. Okay, and I'm gonna pull up 5 units of air because you want to give and take. So I'm taking out 5, so I'm gonna put 5 of air in. Okay, making sure that needle is very small. Put that air in. I'm going to turn it over, being very careful. And with this one, I can overdraw because I want to make sure, a lot of times putting it up in the light to make sure I don't have any bubbles. And then I have 5 units. So I want to turn this so that I have to have 2 licensed personnel verify that I have the correct med and the correct dose. So I go to my first licensed personnel, what do you see? They should tell me that they see NPH insulin 5 units. That tells me I have the correct med and I have the correct amount. Go to my second licensed personnel, what do you see? They should tell me they see NPH insulin 5 units. Again, I verified that I have the correct med and I have the correct amount. Go ahead and take that out. I'm going to put my needle there because we want to do one-handed recap. And these are a little difficult to put in there, okay? And so we've got the on there, just making sure that I still have the 5 units. And I want to put this down below so I can make sure I still have the correct amount in there. Okay, I still have my 5 units. And then I'm going to set this off to the side right here. Okay, then my next medication is going to be my digoxin. So I have Smith Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. I'm going to be giving the 9 o'clock dose. So in my hand, I have digoxin. Now this one is 0.25 milligrams. And expiration date is 11/2026. So digoxin. Now, since this is 0.25 milligrams, I'm to give 0.125 milligrams. So I need to make sure this is where I can score it. So I'm going to score, I'm going to cut this in half, and I'm only going to give a half of the pill, which will give me my correct dose of 0.25 milligrams, okay? So I'll know to make sure that I score that. I'm not going to do it yet because I need to wait into the patient's room because I have to hold if less than 60 beats. So I'm not going to score this till I get into the room. But just knowing I've got the right drug, and then I'll score it to give me the correct amount. Okay. I've got plenty of alcohol there. We never reuse any kind of alcohol swabs. Okay, so I have Smith Brad, date of birth 4/24/1957. I have Rocephin 1 gram, reconstitute with 2.1 ml, 1% lidocaine for a final solution of 350 milligrams per ml. Give 350 milligrams of final solution, IM BID. I'm giving the 9 o'clock dose. So in my hand, I have Rocephin 1 gram. It says reconstitute with 2.1 mils of 1% lidocaine, 2.1 mils, for a final solution of 350 milligrams per mil, final solution of 350 per mil. And I'm going to give 350 milligrams, so that means I'm going to drop 1 mil when I get this reconstituted. So it also says that I'm supposed to reconstitute with lidocaine. I've got 1% lidocaine 1%. The expiration date's 1/2027. The expiration date's 11/27. These are intact, so I can use those. So I'm going to go ahead and use a 3 ml syringe because I've got to draw up 2.1 of the lidocaine, and I can accurately draw up 2.1 with a 3 ml syringe. Then once I get through drawing it up, I'm going to change it to the appropriate size needle. I'm getting IM, and I've got a 22 gauge 1-inch needle, and it's intact. Expiration dates are within expiration date, making sure those are intact, okay? So I'm going to go ahead and get ready to start mixing. Now, before I go on just a little bit further, I'm going to go ahead. I've got my date, time, and initials, and I need to date, time, and initial my my MPH. We had talked about that because since it was new. All right. You don't necessarily have to have gloves on unless you feel like you're going to get anything on you. So I'm going to go ahead and just put some gloves on. But if I'm not going to be touching the meds, I don't necessarily have to have the gloves on, but sometimes these squirt out. Okay, so when I open this, the syringe and the needle are not attached. So I have to make sure that I don't cross over, so I'm going to pull this down. I don't want to cross over that needle, so I'm going to pull my syringe out, making sure that end is not contaminated with anything, and I'm going to connect those two. It's a lure lock, so I'm going to lock it in place. And now I'm going to go ahead and I'm going to pop the lids off of these. But even though I popped them off, I'm going to go ahead and get my alcohol swabs ready. Okay, so it says I'm supposed to use the 2.1 mils of the lidocaine. Don't ever pick it up off the table and reuse it, okay? Just throw that in the trash. And so 1% lidocaine, and I've got my 1% lidocaine. And so I'm going to go ahead and pull back 2.1 because we give and take. The 2.1 of mil. So I'm going to put the air in. I'm going to turn it over, make sure my needle is in the solution. I'm going to draw back. I'm going to get any air that is down at the bottom. Okay, I'm going to push it because this is the first solution. I can push it back up in there, then pull my needle back into the water, into the solution. Pull back till I get 2.1. Okay, there's 2.1. And I'm going to put it in my Rocephin. Okay, and you can see it automatically it's trying to equalize the pressure in there. So I'm going to go ahead and it took that out. I'm going to go ahead and take that out. I am going to recap this one-handed. Okay, my needle's already in there, so that I can roll this and make sure that that powder that's in there okay, looks like all my powder is dissolved. So that means that I have a final solution of 350 milligrams per ml. My order is to give 350 milligrams of a final solution, IMBID. Of course, I'm giving this 9 o'clock, so 350 milligrams per ml, which means I need to drop 1 ml of solution. Okay, so we put the 2.1 in, we took the 2.1 out, and now I'm going to go ahead and put the 1 of air. So give and take that off. I need to re-clean that because I've been crossing over. Okay. Put my air in, and then make sure that my needle, I'm turning it around so I can see that my needle is in the solution. And I'm going to draw up 1 ml, because 1 ml equals 350 milligrams. Okay, put that back on there just real quick. Make sure we get all the air out. Make sure the air is at the top. Go back to 1 ml. So I have 1 ml in there. Okay. Sometimes they'll squirt out at you. And so at this point, I'm not going to recap that. I'm going to go ahead and change out my needle. So I'm going to go ahead and deploy the safety, okay? And I'm going to make sure I open this one so that I'm not, and again, that was a 22 gauge 1 inch based on the fact that I'm giving IM injection. My patient's subcutaneous, I can make sure that needle length is long enough. And then I'm going to go ahead and take this off. I got it on there pretty good. Okay, making sure that that doesn't touch, and then I didn't cross over that new needle, because that's the needle that I'm going to be giving with. Put this in the sharps container. Okay. So I have my 1 ml. I'm going to go ahead and lay this down right here, and I'm going to lay, and I could have done the same thing I did with my MPH, labeled it beforehand, but I've got Rocephin, 1 gram, mixed with 2.1 mils, 1% lidocaine. Final solution of 350 milligrams per ml. I'm giving 350 milligrams, and it's in 1 ml. And the route is going to be IM. I'm giving it at 9 o'clock and my initials. And again, I want to put it down below so that I can read my label, but also I can make sure that I still have my 1 ml, because if I don't have 1 ml, I won't be giving an accurate amount of medication, okay? Since I opened those, I'm going to date, time, and initial. So if they are used again, glove to glove, skin to skin. I took my gloves off, so I'm going to do a medical hem wash. Okay, and now I'm ready to do my last medication. So I have Smith Brad, date of birth 4/24/1957. Tobramycin eye drops, 1 drop in left eye daily. I'm giving the 9 o'clock dose. In my hand, I have Tobramycin optic drops, and expiration's 1/2028, and I'll be giving 1 drop in the left eye, okay? And so I've made sure that the container is intact, and so that was my first check. So I took my medications out of my container, did my first check, and as I did my first check, I prepared, did my first check, prepared on until I get to the bottom. Okay, so now, and I made sure that I don't have anything else in here, and there's not any other here, so we know we've got all the meds out. Now I'm going to go ahead and do my second check. We have Smith Brad, date of birth 4/24/1957. NPH insulin 5 units, subcutaneous AC. I'm going to be giving the 9 o'clock dose. In my hand, I have the Practi NPH insulin, the U100. The expiration date was 5/2026. It's date, time, and initialed. Okay, it was intact. And so I drew up my, and so that's the vial, but I also have to check my, because I took medication out, read my label. So in my syringe, I have NPH insulin, 5 units, sub-Q. I'm giving the 9 o'clock dose in my initials, and I've got to make sure that I still have 5 units, okay? So I've gotten that verified, and I'm going to go ahead and put that back into my container. Okay, do my second check. Smith, Brad, date of birth 4/24/1957. I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60 beats per minute. I'm giving the 9 o'clock dose. In my hand, I have digoxin 0.25 milligrams. Expiration date was 11/2026, so it's okay. But this is 0.25 milligrams. I'm to give 0.125 milligrams, so that's half of this tablet. It is a tablet that I can score, so when I score it, I'm going to give a half a tablet. And I'll have a score so that when I can do that in the room. Okay, Smith, Brad, date of birth 4/24/1957. I have Rocephin 1 gram reconstitute with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per mil. Give 350 milligrams of final solution. IM BID. I'm giving the 9 o'clock dose. So in my hand, I have Rocephin 1 gram, reconstitute with 2.1 mils, 1% lidocaine for a final solution of 350 milligrams per mil, okay? 2.1 mils of 1% lidocaine, final solution 350 milligrams per mil, okay? So I've got that, and we'd already checked the expiration date, 11/27. And then I also, this is lidocaine, 1%, and it's 1/2027, 1% lidocaine, and I took 2.1 and reconstituted it here to get it to 350 milligrams. Then in my syringe, I have Rocephin 1 gram mixed with 2.1 mils of 1% lidocaine, final solution of 350 milligrams per mil. My dose is 350 milligrams, so in 1 mil, and I still have 1 mil, and it's IM, I'm giving the 9 o'clock dose in my initials, okay? So I've done my second check. I have Smith, Brad, 4/24/1957. I have tobramycin eye drops, 1 drop in left eye daily. I'm giving the 9 o'clock dose. In my hand, I have tobramycin optic drops, optic means eye, expiration 1/2028, and I'm giving 1 drop in the left eye, okay? So, and it is intact, expiration date was good, and so that was my second check. So, I don't have any other medications here, so I've finished my second check, making sure I've done my second check on here. My meds are in there. So I'm going to go ahead and make sure I have everything that I need when I go in there. So I've got a washcloth, a tissue, and I've got alcohol swabs for doing my giving my medications. I've got a cup, I've got a pill cup, and so now that I've got everything ready, I've done my 2 checks in the medication room. Now I'm going to get ready to leave the medication room. And when I leave the medication room, I'm going to go ahead and do a medical hand wash. And during this whole time when I am preparing medications, I want to make sure I keep my meds in my peripheral so that I can see my meds at all times, okay? So once I've done my medical hand wash, I'm going to gather my stuff, and then I'm going to go ahead and leave the medication room, get ready to go to my patient's room. Okay, we are going to be doing kind of the third portion of our med administration. So we've already checked our MAR, verified it to the doctor's orders. We've been to the med room, we've done our 2 checks in the med room, and now we're coming to the patient's room. So we're gonna knock. Good morning, my name is Jan Bucks-Kemper. I'm a registered nurse, and I'm gonna be giving you some medications this morning. So before we get started, let me get my hands washed here. And I'm gonna pull up your chart, okay? And can you tell me your name and date of birth? Brad Smith, 4/24/1957. I've got Brad Smith, 4/24/1957. And I'm going to put the cursor there. And Mr. Smith, are you allergic to anything? So I scan the armband, okay? Codeine, okay? And it says codeine, and I have codeine. What does codeine do to you? Okay, all right, well, we're not going to be giving you any codeine today, but I'm going to go ahead and raise the bed up to a good working height. And I'm going to go ahead and do my 3rd check on my medications, and then once I do my 3rd check on my medications, let me just look at that real quick. Okay, and then I will explain all of them. We'll do our assessment and get all of that done, okay? All right. All right, so for 3rd check, I've got Smith Brad, date of birth 4/24/1957. I have MPH insulin, 5 units, subcutaneous AC. I'm going to be giving the 9 o'clock dose. So I've got my MPH insulin, it's U100 MPH insulin. Expiration date was 5/2026, and so that is correct. And in my syringe, I have MPH insulin 5 units. It's sub-Q, it's the 9 o'clock dose, and I've got my initials there, okay? So, and I want to make sure that I still have 5 units, which I do, okay? And so I'm going to put that right there, and I'm going to go ahead and scan my medication, okay? And so I've got that one done. I've got Smith. Let me get my next one out. Okay, so I have Smith Brad, date of birth 4/24/1957. And I have digoxin 0.125 milligrams PO daily. Hold if pulse is less than 60. I'm going to be giving the 9 o'clock dose. So in my hand, I have digoxin. It's 0.25 milligrams, and I'm supposed to give 0.125 milligrams. So I'm going to need to, I need to cut this in half. It's able to score. And when I cut it in half, I'm going to give 1/2 tablet, and that will give me my dose of 0.125 milligrams PO. And so I'll take the pulse before I score that, okay? So I'm going to go ahead and okay, and I'm not going to score that until I take the pulse on that. But I've got my scorer right here in case for us to do that. Because I don't want, if it's less than 60, we don't want to waste our medication. Okay, so then we have, excuse me, Smith Brad, date was 4/24/1957. I have Rosefin 1 gram, reconstitute with 2.1 ml, 1% lidocaine for a final solution of 350 milligrams per ml. Give 350 milligrams of final solution, IM, BID. I'm giving the 9 o'clock dose. So I have Rosefin 1 gram, reconstitute with the 2.1 mils, 1% lidocaine for a final solution of 350 milligrams per mil. And so it's 2.1 mils is 1% lidocaine for a final solution of 350 milligrams per mil. And so then I have my lidocaine 1%. The expiration date is good, and the expiration date, we'd already checked all of those on that. So my lidocaine, and I took 2.1, mixed it with my Rosefin to give me my final dosage of 350 milligrams per mil. So I'm going to give 350 milligrams. So in my syringe, I have Rocephin 1 gram mixed with 2.1 mils of 1% lidocaine for a final solution of 350 milligrams per meal. So my dose is 350 milligrams per meal, and I have 1 meal, and it's IM. I'm giving the 9 o'clock dose and my initials. So I need to scan. Sometimes they won't scan, so okay, and I need to scan. That one, because it's rotated on there, didn't scan as well, so I'm going to go ahead and put that on there. So I've done my 3rd check and scanned as I go along. Okay, and then I have Smith Brad, date of birth 4/24/1957. I have Tobramycin eye drops, 1 drop in left eye daily. This is going to be my 9 o'clock dose. And I have Tobramycin optic drops. Optic means eye drops. Date of birth, expiration 1/2028, and so the container is intact. And again, I'm going to be giving 1 drop in the left eye. Okay. So now that I have done my 3rd check and scanned, and I've scanned my patient's armband. All right, Mr. Smith, we're going to start giving you your medications. And so the first one I'm going to talk about is your MPH insulin. This is for your diabetes, and so it's to control your blood sugar. Your blood sugar, we checked it this morning, and it was good. It was in the normal range, which that's where we want it to be. But with your insulin, with your diabetes, you know, it causes you to have high blood pressure or high blood sugar. And so with that, you know, signs and symptoms we want to watch for: excessive thirst, excessive hunger, excessive urination. Sometimes it can decrease your appetite, but if you kind of start feeling like irritable, those are things that causes the high blood sugar. Now, when we give you your insulin, this is an intermediate acting. The MPH, it's going to help maintain your blood sugar at a normal level, but sometimes it might cause it to go low. So hypoglycemia would be, so you started kind of feeling irritable, if you start feeling a little anxiety, maybe some numbness, tingling, restlessness. We're going to teach your family about if you start kind of getting some confusion. But with all of that, we want to make sure that if you need to get out of bed, you call us, okay, before you get out of bed, because we'll come help you to do that, okay? We don't want you to fall or anything like that. And so with that, we're going to go ahead and talk about the different sites. So we can give in the arms, and so we're going to find the acromion process, go down to the elbow. Anywhere in that back side on both arms, we can give that. Now we've got some privacy here. And we can give it in the abdomen. So we're going to find your belly button. We're going to mark it in half. And of course, we're going to stay away from that dressing. But we're going to stay 2 inches away. And anywhere in these quadrants, we can give your insulin. And then the other place we can give it is in the top part. So we've got a hand above the knee, right at the groin, and anywhere on this anterior portion that we can give subcutaneously. We'll give that medication. And then once we give this insulin, we've got to make sure within 30 minutes that you've eaten something. So I've made sure that the breakfast tray is out in the hallway. So as soon as we get your meds done, I'll get your breakfast tray in here, okay? Any questions on that? So do you give this at home? All right, you probably give it in your abdomen and your legs. So we're going to work on your arms. Do you know where you got it last? In your right arm? Okay, so we're going to give it into your left arm, okay? All right, so then the other thing is we've got your digoxin. And with dig, it's an antiarrhythmic. And so the things we want to watch for is if you start having any nausea and vomiting, or the big thing is if you start having any visual, like green or yellow halos or vision, you need to let us know immediately. Sometimes it can make your heart rate be a little irregular, And a thing before we give this is we've got to make sure that we do an apical pulse. So again, we've provided for privacy. And we'll teach you how to do your pulse. Let me get my stuff cleaned here. And so we've got our privacy. So we're going to need to do an apical pulse because the order says that if your pulse has to be above 60 in order to us to give this. Okay, so we're going to go to the second intercostal, third, fourth, fifth. We're going to go mid-clavicular. And we're going to listen for a full minute. Okay, it's been a full minute and I got 80, so we will document that in our chart, so that means we can go ahead and give that, okay? And so there's some other things that we'll, during our assessment, we'll be watching for, but those are some things we want to watch for. I'm also going to be giving you your tobramycin eye drop, just one in your left eye, and so we will be assessing your eye, we'll be cleaning it. If you have any kind of irritation or it gets more red or some rash around it, then we're going to need to, we'll let the doctor know about that, okay? But this is an anti-infective. And then the last one we're going to give is we're going to give your, it's Rocephin and lidocaine. This is another, the Rocephin is another anti-inflammatory or anti-infective. And then the lidocaine is, it helps with pain control, giving it, and so this is going to be IM. And with this one, we're going to assess the signs and symptoms of infection in the wound for what we're giving this for. But we're going to watch for any kind of rashes, any kind of changes in your bowel. Maybe if you start having any kind of growth in your mouth, it's called thrush. We need to make sure we know that, okay? So sometimes it's kind of give you diarrhea, so we'll be checking your bowels and how those are doing. But any kind of major rashes or irritation, itching or anything like that, you need to let us know, okay? So for IM, we can give it in the arm, in the deltoid. So we're going to find the chromium process, put 3 fingers, we're going to do upside down triangle, and we can give that no more than 1 ml, but typically this is for vaccinations, okay? Then the other place is going to be in your thigh, the ventral gluteal, okay? So I'm going to put a hand above the knee, one at the groin. My thumbs are going to be on the lateral side of your leg here. And then I'm going to draw imaginary lines, so anywhere in this muscle, the vastus lateralis, okay? The other one is the ventral gluteal. And so I'm going to get you to kind of roll over and bend your knee. That way it kind of relaxes this muscle. And so this is the left, your left hip. So I'm going to use my right hand, and I'm going to put my hand on the greater trochanter in my palm. Okay, it's kind of a little difficult to do that here. But my left hand on the palm on the greater trochanter, my thumb is going to be pointed towards the groin. Then I'm going to put my index finger on the anterior iliac crest. I'm going to spread my fingers and in this area right here, okay? So find the anterior iliac crest, the greater trochanter, my palm, my right, this is my left, so my right hand would be there. It'd be facing this way. My thumb would go to my groin, my index finger to the anterior iliac crest, and then I would spread my fingers and it would be back there in the ventral gluteal, okay? And you had it in the right, so we're gonna give it in the left today. Okay, any questions about any of those? All right, so since we've done that, I'm gonna go ahead, normally we would do the least invasive to most invasive, but I'm gonna go ahead and give you your Rocephin and lidocaine injection because I need you kind of laying down, and then I'm gonna do the other ones while you're sitting up. So we're going to use do our IM injection first, and so I want to make sure I still have 1 mil, and I've got this is my Rocephin in the lidocaine, okay, because I've got 2 syringes, making sure I've put a 22 gauge 1 inch to make sure I could get down into the muscle. And so with this, we're going to use the Z-track method, okay. So I'm going to pull the skin to the side. I'm going to clean from the inside out, okay? Making sure I don't go back over where I just cleaned, okay? Let that drop. And going in a 90-degree angle, 1, 2, 3. I'm going to support. I'm going to go ahead and give slowly. And then if you have any irritation around that, I'm going to count to 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Come straight out. I'm going to deploy my safety, and I'm going to go straight to the sharps. I'm going to assess the area. We're going to do a glove to glove, skin to skin, and I'm going to do a medical hand wash. Okay, so we're going to go ahead and sit you up. Okay, are you good there? Okay, I'm going to go ahead and give you your insulin. Now, like I said, the breakfast tray is outside, so we need to make sure you're eating something within 30 minutes. And we're going to rotate in your arms since you give it in your abdomen and your legs at home. Okay, so we've assessed the site, found our site. And I've got my NPH insulin, and I still have my 5 units in there, okay? Sub-Q can be either 45 or 90 degree with insulin. They want you to do it at a 90-degree angle, so I'm going to go ahead and pinch an inch. I'm going to clean from inside out. I'm going to make sure I don't reach over the area I just got through. And at a 90-degree angle, 1, 2, 3, I'm going to go ahead and give that 5 insulin. This one has, this is deploy the safety device. And we're going to make sure we're not rubbing or anything. So I'm glove to glove, skin to skin. Do another medical hand wash. And then we're going to go ahead and okay, I'm going to go ahead and give you your, since your pulse was 80 and it's above 60, so we can go ahead and give this. And so this is your digoxin. So I've got my cutter, it's got the razor blade in there. I've made sure I've cleaned it because we're not sure who had used it before and whether they cleaned it or not. So we've cleaned all of that. I'm to take my pill out because we've already scanned all of our medications, did our third check scan, okay? Okay, so I'm going to line the line that it has with my razor blade, so it's going straight with the razor blade, and then I'm going to go ahead and I'm going to break that, okay? So I'm going to put half of it in there. I'm going to take the other half and I'm going to put it in the sharps container, okay? And so with us breaking that in half, that's going to give me the 0.125 milligrams, which is the correct dose, okay? Have you had any problem swallowing? No? Okay, so take me a little swallow, okay? Take your medicine. Here's another drink, okay? Did you get that down okay? Can you open your mouth and let me look? Lift your tongue up. Sometimes if your mouth gets dry, it's kind of hard to swallow that, but you got that down okay? Okay, good. All right, and I'm going to clean this up so it's ready for the next person to use. And I'm going to do glove to glove, skin to skin, do a medical hand wash. All right, the last thing we're going to give you is your eye drops. Okay, and I'm going to go ahead and just kind of put your head, the pillow down below your head here so you can kind of extend your neck back a little bit, okay? And we're going to be looking at your eye and assessing the eye itself. We're going to assess the conjunctiva when we pull down to the inside of your eyelid to see the redness. We're going to see if there's any drainage or anything. So I'm going to take a warm wash rag and I'm going to clean from the inside of the eye out. And take another section of my washcloth, again clean from the inside to the out, okay? Making sure we get any little crusties, checking for those, and I would put that in the linen hamper. Then I'm going to get a tissue, and I've got my tobramycin. We're just going to be doing one drop. So I'm going to take the lid off, and I'm going to support my hand on your forehead, and I'm going to gently pull down your lower eyelid so I can see the conjunctiva there. And so what I want you to do is I want you to look up, because I don't want to drop this on your eyeball. I want it to go into the lower conjunctival sac there, okay? So look up, okay? And I'm going to put one drop, okay? And then I'm going to put some pressure on the nasal lacrimal duct for 30 to 60 seconds. Now, one of the things that you've got to be careful of, if you're going to be doing this at home, you also don't want to make sure you touch the tip of this to the eyelashes, because the eyelashes have a lot of bacterium on them, and then that could contaminate the tip of this. So I took it off, did the one drop, and then I'm going to put my lid back on. And I'm going to put the pressure, we're going to put pressure for 60 seconds, 30 to 60 seconds, because we want to keep this medication in the local, in the eye area. We don't want it to become systemic, okay, throughout the rest of the body. Okay, so it's been 1 minute, okay? Plenty tears or anything up like that. Are you doing okay? Okay, so glove to glove, skin to skin. I'm going to do my medical hand wash. Alright, so you doing okay? Not any problems so far? Okay, like I said, we're going to get that breakfast tray to you here in just a little bit. So I'm going to put your bed in the lowest position. Side rails are up ×2, wheels are locked, your call light's within reach. I'm going to leave your head of the bed up because you took that medication for at least 30 minutes, but because you're going to get your breakfast here in just a little bit, okay? And so once we've given everything, I'm going to come over here and I'm going to document. So I need to document where I gave my insulin. So I did that in the left. upper arm, and then I'm going to put my JB. Okay. Down here underneath my DIG. Now, when we scanned it, it said it was an overdose. So in the hospital, it'll actually have you can go in there and say that you gave a half a tablet of that. So I'm going to go ahead and put the half a tablet. Oops. Gotta spell it right. Half a tablet, and I need to put that the apical pulse was 80, okay, because that shows that we did our assessment beforehand. And then we're going to do my JB, because that means I gave the medications, okay. For the Rocephin, we gave it in the left ventral gluteal, and I gave my JB. That's why because the patient may not be able to tell the nurse, the next nurse, where they gave it, so they know where that it was given, okay? And then in the tobramycin, I don't have to put anything in this because I gave it in the patient's left eye, and I gave 1 drop. So all I have to do is just initial that I gave that medication, okay? So we did our assessment, then I'm going to come down here, and I need to put J. Bucks-Kemper, my credentials, and then I need to put my JB, so that anybody, if the patient had any problems, they can come back and say, okay, well, JB gave that, who's JB? JB is J. Bucks-Kemper, okay? So that means I have signed my MAR, and I've documented everything for my MAR, so I'm going to go ahead and close my chart out, okay? And make sure, now, are you comfortable? Is there anything that I can get for you? No? Okay, so we're going to be bringing that breakfast tray here in just a little bit. And because we've given you that insulin, we need to do 30 to 60 minutes to get that in here. So is there anything else that I can get you before I leave? Okay, well, if you do, just put your call light on, and we'll be back in here with your breakfast tray. And then call to get up if you need to go to the bathroom or anything, okay? And so I'm going to go ahead and leave the room.